Hi there, Rosa Ferdosian here from Blue Sky Health Services. I've made a video on autism, which I hope you enjoy. Autism spectrum disorder, also known as autism or ASD, is a spectrum disorder ranging from high to low or mild to severe. An individual on the autism spectrum often experiences severe impaired social functioning, as well as communication and behavioral skills. There are 3 levels of autism, and they are simply called level 1, level 2, and level 3. Level 3 is the most severe type of autism. Autism is a developmental disorder which can fall under pervasive developmental disorders or PDD, or pervasive developmental disorders not otherwise specified, PDD-NOS. Individuals fall on the spectrum in different ways, having different kinds of skills, abilities, and characteristics. Researchers are still unaware of the exact causes of autism. However, there are certain common features, including challenging and concerning behavior, as well as difficulty in social interaction and communication. People on the autism spectrum can sometimes delve into a topic which is not of interest for many others. For example, one of my clients had an interest in vacuum cleaners. The client could tell you almost everything about the history and functionality of a particular brand of vacuum cleaner, which he used to find fascinating. The client would go over and over the information that he had found about this particular brand of vacuum cleaner with people around him. Yet a lot of people would tell him that, you've already shared this information with us, or why don't you go and look for something else? It was just quite unusual for the majority of people around him that this person was just so invested in this particular topic. As mentioned earlier, autism is a spectrum disorder ranging from high to low functioning, and individuals with high functioning autism are often more able to learn new information and live independently, whereas individuals with low functioning autism might find living independently quite challenging. Another common symptom in ASD is sensory processing impairment or sensory overload. So for example, people on the spectrum could be quite sensitive to a particular noise or sound, or a particular texture. Large crowds, certain bright colors, and certain materials or clothing are also some of the other examples of situations where an individual on the spectrum can experience sensory overload. Sensory processing impairment is different from individual to individual. And in fact, ASD is quite different from individual to individual. So apart from the common features which we've just named, the other symptoms might vary from one person to another. I've been asked many times whether aggression is a symptom of autism, and the answer is simply no. Aggression is definitely not a symptom of autism. However, we do see some people on the spectrum displaying aggressive behavior, such as kicking, hitting, yelling, and that could well be due to a sensory overload rather than aggression being a symptom of autism. Overall, individuals on the spectrum have an intense need for routine and can become significantly distressed when there is a sudden change in their routine. Applied behavior analysis or ABA therapy has been a successful strategy to assist individuals on the spectrum to improve their symptoms and help them learn appropriate skills they're required to live independently. At Blue Sky Health Services, we do use ABA quite regularly, especially with our early intervention and sort of the younger clients. Regarding medication, there is no medication to cure autism at this stage. However, some medications can assist in reducing anxiety and certain behavioral issues that an individual on the spectrum may be experiencing. Sometimes doctors or psychiatrists recommend selective serotonin reuptake inhibitors or SSRIs, which can help with anxiety or obsessional behaviors in individuals on the spectrum. Other medications such as Ritalin or Concerta may also assist with hyperactive behavior in some individuals on the spectrum. I hope you enjoyed this video. Let me know if you have any questions. You can contact me directly on rosa@blueskyhealth.com.au. Otherwise, you can also contact the office. I'll post the contact details at the end of the video. Thanks.